Welcome. This is Dr. Allison Moser. I am currently faculty in the section of geriatrics at Cedars-Sinai Medical Center in Los Angeles, California. Today I will be discussing the work on nursing home quality indicators we've completed under a contract from Baycrest to RAND and led by Dr. Deborah Saliba from the UCLA Bourne Center and the VA GREC. The project was also supported by the Morris Justine Family Charitable Foundation. I will be discussing our article in the October 2018 issue of JAMDA, the Journal of Post-Acute and Long-Term Care Medicine. The article is entitled Quality Indicators of Primary Care Provider Engagement in Nursing Home Care. Many existing measures of quality for nursing home care emphasize facility-level processes and characteristics and are not designed to evaluate the role of the primary care provider in the nursing home setting. For example, the Centers for Medicare and Medicaid Services quality measure on pressure ulcers. This may reflect not just medical care, but such things as staffing ratios at the facility, environmental factors, or a more frail resident population. So the rate of pressure ulcers reflects the functioning of the overall health system rather than the individual primary care provider. We therefore desired to create quality indicators that would be under the primary influence or control of the primary care provider. This would allow for a more accurate and useful provider-level quality assessment and an opportunity to compare at the practice level the extent to which different staffing models allow for adherence to quality indicators. We aim to demonstrate the added value of increased primary care provider engagement in improving nursing home care quality and ultimately patient outcomes. Quality indicators were identified in a two-step process. First, our international research team identified candidate items. Second, a technical expert panel reviewed, modified, and rated quality indicators using the RAND modified Delphi process. The technical expert panel consisted of physicians and advanced practice nurses with expertise in nursing home care. They were selected for their knowledge and leadership in post-acute and long-term care. The 11 panelists came from the United States, Canada, and the European Union. Initially, 103 items were presented to the technical expert panel for pre-meeting review and rating. During the meeting, 18 items were added and an additional 18 were modified. 7 items were rated not valid. 8 items were rated valid but not feasible. 11 items were eliminated because a similar but more stringent quality indicator was identified, and that was rated as valid and feasible. This left 95 valid and feasible quality indicators. Quality indicators were identified for 7 domains: communication and coordination of care, cognition, affect, and behavior, urinary incontinence, goals of care and palliative care, falls, mobility and pressure ulcers, medication management, and pain. Examples of quality indicators in each category are shown in this table, and the full list of quality indicators is available in the article. The indicators are designed to be under the control of the primary care provider. For example, if a nursing home resident is prescribed a new medication, then the subsequent primary care provider note should document the response to therapy and continued need for the medication. This project created much needed performance measures that can be used to assess care quality and that can inform interventions to improve the health-related quality of life of nursing home residents. We expect these measures to contribute to articulating and defining activities distinguishing high-quality practices and thereby informing policy and payment discussions. These quality indicators can serve as a clinical teaching tool for trainees or providers new to the nursing home setting. By specifying the care processes through which primary care providers add value, These quality indicators could illuminate the relationship between primary care provider engagement and better resident outcomes in the nursing home setting. Thank you for listening. For further details, please refer to the article in the October 2018 issue of JAMDA, the Journal of Post-Acute and Long-Term Care Medicine, which is available at jamda.com.